welcome back to Grow Med. This is a series of discussing daily one important topic for the upcoming Fmge exam, and the people who are attempting the Neetpg, you can also refer to these videos because I'll be discussing both the things, and these questions can be similar in Fmge as well as Neetpg. So Neetpg people also can refer to these videos. Okay, so yesterday we had discussed about the hernias. So today's topic is vitamins, as it is a very important topic, and surely 3 to 4 questions are going to come in both the exams, Fmg as well as the Neetpg. So you cannot miss this one topic. So quickly we'll discuss all the things which you must know for the exam. So there are various vitamins you might be knowing: A, D, E, K, then B complex 1 to 12, and C. Okay, so we'll discuss all the things one by one. See, the vitamin A, it is present in the three forms: retinol, retinal, and the retinoic acid. Okay, so these are the chemical forms. So this is the requirement. How much is the daily dose requirement? See, like for adults it is 600 microgram per day, then 800 microgram per day for the pregnancy, and for the infant 350 microgram. So these questions can be asked in the PSM point of view, because they can just ask like what is the daily recommended allowance or for an adult for an pregnancy or infant. Pregnancy is the must. You should remember the pregnancy doses, because questions are asked on this pregnancy ones. Then functions is it helps in the vision and epithelial differentiation and the normal reproduction. Okay. Then sources. So these are the sources. Halibut liver oil, this was asked in the PSM. I exactly don't remember which exam, maybe either in the 2018 or the 19 one. In the Fmg this question was asked, that halibut liver oil source of vitamin A. Then these are the other sources. Okay, cod liver oil, green leafy vegetables, and the carrots. So deficiency, whenever there is deficiency of the vitamin A, we can see clinical features involving the eyes, because see, it helps in the vision. No, so vitamin A deficiency can cause nyctalopia. Nyctalopia means night blindness, because vitamin A is required for the differentiation and for the rods, for the maintenance of the rods. Like see, this is the eyeball, center में cones present है, peripheries में rods present है. So the central vision is provided by the cones and the peripheral vision provided by the rods, and along with that the night vision is also provided by the rods, whereas the day vision is provided by the cones. So इसीलिए whenever there is vitamin deficiency, you can see night blindness, that is called as a nyctalopia. Along with that, you can also see xerophthalmia. Xerophthalmia meaning dry eyes, and keratomalacia is a ulcer, formation of the ulcer, a very like a stage greater than this dry eyes. When first the eyes will become dry, and due to the dryness there will be formation of an ulcer called as a keratomalacia. Okay. Then bite or spot, this question, see, due to the vitamin A deficiency you can see a foamy white lesion. So this can be described like in a clinical case, foamy white lesion on the sclera. This also can be described in the case, and its name is called as the bite or spot. So this is the image based question was asked in the July 2024 exam. Okay, July 2024 exam, this was asked by dot spot. Okay, a very famous questions, and if at all you have solved the PYQs, then you might have come across this question and the image by dot spot. Then this is a classification of the xerophthalmia. It is classified into various categories like ZN. N stands for the night blindness. You can just remember it, N for night blindness. And this night blindness in children, this is the earliest symptom. So questions 1-9ers are asked that which is the earliest symptom of the vitamin A deficiency, and it is the night blindness. Okay. Then conjunctival xerosis is the earliest sign, and it is given as the name X1A. X1B stands for the bite dot spot. Again, the name you can come to know, B for bite dot spot, and it is a first clinical sign. Then 2 stands for the xerosis. 3A stands for the corneal ulceration. See, 3 both stands for the corneal ulceration, but the difference is that keratomalacia will be less than 1 and 3, involving 1/3 surface, and keratomalacia, if it is involving more than equal to 1/3 surface, then it will be 3B. Then S means scar, so you can remember here with the name itself, scar, and F means the fundus, xerophthalmic fundus, involving the fundus. Okay, so this is about the classification. I hope you might have understood the classification as well as the question asked on this one. ठीक है. Then let's move on. So national immunization schedule पे भी vitamin A is given and this is also asked from PSM. ठीक है, तो मैंने ये PDF ऐसे बनाई कि I'm covering the PSM points, the biochem points, then the questions asked from the ophtha also, like other ophtha where bite or spot का ये, this is a question from the ophthalmology, this is also comes from the ophthalmology. ठीक है, तो विटामिन के जितने भी पॉइंट्स, जितने भी सब्जेक्ट्स में, सारे मैंने कवर करके कंपाइल करके एक चीज़ PDF में बनाया है, एक वीडियो में आपको सब एक्सप्लेन किया है. ठीक है. Then so according to the national immunization schedule, what is the dose given and at what age the dose is given, that is important. See, until the 9 months we at the 9 months we will start it from the 9 months, and at the 9 months we will be giving 1 lakh international units, and after 9 months we will be giving every 6 months 2 lakh international units till the 5 years. I hope you have understood. See, until 9 months we will not give vitamin A. After 9 months we will start giving vitamin A to the child. Oral drops रहते हैं usually, oral vitamin A. Then 1 lakh international units is given at first, then up to um, 6 months. After 18 months of age we will give it to the 2 lakh international unit, and it also depends, the unit also depends on the levels of the vitamin A. If the child is having vitamin A deficiency, then we will be giving 2 lakh international units. ठीक है, तो this also matters, the deficiency या फिर age. Okay, and total how much is given? 17 lakh international units is given. This is a total one. Okay, this was all about the vitamin A, which you must know. Then moving on to the vitamin C. Vitamin C also called as the ascorbic acid, and do remember the names, interchanging names, because questions are asked like this only to confuse you. Vitamin C के बदले they'll give you ascorbic acid and you'll get confused. What is the question asked? Okay, so well, let's look at the function. It is an antioxidant, helps in the iron absorption. PYQ asked multiple times that which vitamin helps in the absorption of the iron. So it is the vitamin A, and also helps in the post-translational modification of the collagen. Okay, see, this is a very important point from the clinical aspect also, because collagen helps us in building the connective tissue, right? And vitamin C helps in post-translation modification of the collagen. So whenever there is deficiency of vitamin C, the collagen will not be formed properly. That means connective tissue will also not be formed properly, leading to dry skin, bleeding problems. The skin will be dry, and this is called as the scurvy. ठीक है, so a clinical aspect and important disease which you must remember, scurvy. Scurvy क्यों होता है? क्योंकि कोलेजन की abnormality की वजह से होता है, due to vitamin C deficiency. See, here you can see the aspect scurvy. Then clinical features, these will be described in the clinical case. So when, if at all you find these things, these history or these clinical features described in the clinical case, and in the options vitamin C deficiency is given or scurvy is given, blindly mark the answer as that one. ठीक है, swollen gums, wound healing, easy bruising and fatigue. Okay, and this question vitamin C, I think this was asked in the December 2023. December 2023 this question was asked, and this question was also asked, iron absorption 2023 December, this question was also asked. Okay, so yes, see, vitamins is a very important topic and frequently questions are repeated, so it is a must, you should know these things. And these two are important, one iron absorption, this one, and this scurvy, this clinical case, this is a must, you remember this one. And in the recent exam, they had asked a question on this vitamin C, that vitamin C is a cofactor for which enzyme, or which enzyme is dependent on the vitamin C. So it is the lysyl hydroxylase. Okay, so this was a recent question asked in the recent exam, the Jan 2025 one. Okay, then these are the sources of the vitamin C. I think these sources to we know only since childhood. We are reading about the citrus fruit, amla, gawa. These are the rich sources for the vitamin C. Then moving on to the vitamin D. So these are the chemical forms of the vitamin D, and this one is the active form, cholecalciferol. This question was asked in the 2019 one. Which of the following is the active form of the vitamin D? Okay, so it is a cholecalciferol. Then the recommended allowance in the adults, it is 10 to 20 microgram per day, pregnancy 15 micrograms. And the function is intestinal absorption of the calcium, helps in the intestinal absorption of the calcium. These are the sources, halibut fish oil and cod fish oil, usually fish oil, and sunlight is another source for the vitamin D. Then deficiency C, in children's it will cause rickets, and in adult it will cause osteomalacia. Osteomalacia, the other word is the soft words, soft bones. Like if you break the words, the meaning of this one is the soft bones. So there will be fractures in case of adults. Like this history will be given in the clinical case. And lumbar vertebra pain, back pain will be considered in the case, and it will be given like a elderly male or elderly female is having back pain, has history of pathological fractures. So what will be the cause? So it will be the vitamin deficiency, osteomalacia will be the cause. And in case of children's, no, it is rickets. So the clinical features seen with the rickets are delayed closure of the fontanelles, frontal bowing will be seen, bowing of legs. This one is a very important one given in multiple cases. Then dental hypoplasia and ricketic rosary, these are the features seen with the rickets. And vitamin D supplementation is the only treatment available for this one. ठीक है, vitamin D के साथ we can sometimes give calcium supplementation also. So this is all about the vitamin. Now moving on to the vitamin K. So these are the three chemical forms of the vitamin K: phylloquinone, minaquinone, and minadione. Do remember these names please, because in एग्ज़ाम these names are asked instead of vitamin 1 to 3 K और K. So मतलब कन्फ्यूजन हो जाती है. यू विल बी लाइक ये तो हमने पहली बार पढ़ा है, तो हमने पढ़ा ही नहीं. तो इसीलिए इट इज़ बेटर टू रिमेंबर दिस नेम्स बिकॉज क्वेश्चन वर आस्क्ड ऑन दिस ऑल्सो, विच इज़ फैट सोल्यूबल, विच इज़ वाटर सोल्यूबल. ठीक है, तो दो फैट सोल्यूबल है, फाइलोक्विनोन एंड मीनाक्विनोन, एंड मीनाडायोन वाटर सोल्यूबल. यू कैन रिमेंबर दैट द नेम. क्विनोन मतलब फैट सोल्यूबल है, डायोन मतलब वाटर सोल्यूबल. ऐसे करके आप रिमेंबर कर सकते हैं इसको. Then function is gamma carboxylation of the glutamate for the factor 2, 7, 9, 10. Important, very important, asked as a PYQ, the function of the vitamin K. And deficiency will cause neonatal hemorrhage, but prevention कैसे करेंगे हम? vitamin K supplementation to the mother. See, vitamin K helps in carboxylation of these factors 2, 7, 9, 10. And whenever there is deficiency of vitamin K, these factors will be not glycolated and these will be causing bleeding. ठीक है, तो bleeding manifestations होगी, and most commonly this is seen in the neonates. तो neonatal hemorrhage is the most commonly seen with this. So this is all about the vitamin K. Then vitamin A, also called as tocopherol, its function is antioxidant, and the deficiency में it will cause neurological disorders and hemolytic anemia. Vitamin E पे इतने questions पूछे नहीं गए हैं, not that important, but yes, as we are discussing about it, so you must know it. Then let's move on to the B complex now. B1, 2, 3, 4, 5. Quickly discuss all those things. B1 is a very important one. ठीक है, you can't miss it. So it acts as a cofactor for various enzymes, and it acts as a cofactor for the branched chain alpha ketoglutarate dehydrogenase, then ketoglutarate dehydrogenase pyruvate, and transketolase. This one is a very important question, important one, asked as a clinical case also, simple one liner also. That marker for the vitamin B1 deficiency is transketolase. It acts as a marker. ठीक है. Then deficiency will be causing beriberi, dry and wet beriberi. See, dry beriberi will be causing neurological manifestations, neuropathy होगी और proximal muscle weakness होगी. But wet beriberi will be causing heart failure and edema. So in the clinical case, you should see what kind of features are described. If they describe like muscle weakness is there, tingling sensation is there, anything associated with the nerves, then go with the dry beriberi as the answer. And if they describe like edema है, shortness of breath हो रहा है, then edema भी है, हार्ट के कुछ दे देंगे जैसे कि हार्ट एनलार्ज्ड है ऐसे करके कुछ, तो देन इन्वॉल्वमेंट ऑफ द हार्ट थिंक एज वेट पेरीबेरी. ठीक है, so this is about the vitamin and thiamine is very important in the alcoholics. ठीक है, तो alcoholics will be having deficiency of this B1 because chronic alcoholism will be causing the gut क्या बोलते हैं, इंटेस्टाइनल विलाई या फिर इंटेस्टाइनल सेल्स की जो डैमेज करता है ये chronic alcoholism. Due to that, the B1 will not be absorbed, and that will be leading to deficiency of the B1. And whenever this deficiency of the B1, mainly in the alcoholics, you can see these features: Wernicke's encephalopathy and the Korsakoff's phenomenon. So whenever we call this as Wernicke's encephalopathy, global confusion of Fmge and ataxia, we remember it by the mnemonic GOA. Wernicke's encephalopathy, GOA. ठीक है, तो see, this is a classical presentation given in the exam. जो तो केस होता है ना, उसमें तो क्रोनिक अल्कोहल दिया ही दिया होता है. कम्स टू द इमरजेंसी with the complaints of global confusion of Fmge ataxia. What is the cause or what is the management? The management is usually we will be giving loraz plus thiamine and cause is B1 deficiency. ठीक है, so these are the two important questions asked. So we have discussed it कि इस पे कैसे केस आ सकता है, तो remember this one. Then Korokov's phenomenon is the patient will be presenting with confabulations, amnesia, anterograde and personality changes. ये इतना common नहीं है, this is not that common, this is like dangerous and it is rarely seen, but Wernicke's encephalopathy जो है ना, it is very common and a lot of patients come with this one, Wernicke's encephalopathy. ठीक है, so B1, these are the things which you must remember. Then B2 is the riboflavin, the other name, and it acts as a cofactor for the FAD and the Fmn. Deficiency will be causing angular stomatitis, cheilosis and glossitis, and the marker is the glutathione reductase PYQ. ठीक है, तो इसको मार्क कर लेना. This one is a PYQ. And angular stomatitis means see मतलब lips पे it will be causing burning sensations, and if this is the lips, तो lips के area पे you can see something like skin rashes, dermatitis type का, and that one is mainly due to this B2 deficiency, angular stomatitis. ठीक है, I hope you have understood about this one. Then B3, तो B3 पे also called as niacin, famous question, बहुत important, and there was no paper in the Fmge or the Neetpg there, it doesn't contain a question on this niacin पे either they are asking the questions on the cofactors or the deficiency. This pellagra quite famous, मतलब I am expecting that in the upcoming exam also this will be coming, definitely coming, and you will get a 1 mark from this one. ठीक है, तो it acts as a cofactor for the NAD and the NADP. Deficiency will be causing pellagra, and the symptoms of the pellagra are the dementia, dermatitis, diarrhea and death. So we remember it like 4 Ds of pellagra. Then death is the most serious one, and it happens if pellagra is not treated early. Then this is seen most commonly in the maize eaters. So clinical case will be like, the framing of the case will be like something associated with the maize eaters, then comes with the dermatitis, dementia, then exposed, which increases when exposed to sunlight, and they can give the image also. It will look something like this. What is the diagnosis? So it is the pellagra. What is the treatment? Niacin supplementation. ठीक है, then see Kazal's necklace. This is the image based question asked, and see, you can see here, this is the necklace. This is the present at the sun exposed areas. This is also, see, you can see that the dermatitis is occurring on the sun exposed area, and this is called as a dermatitis, the classical feature seen with this niacin deficiency. This, remember this image, a must know image. Then vitamin B5, called as a pantothenic acid, cofactor for the vitamin A, and it causes burning feet syndrome. This was the only question asked from this vitamin B5. I exactly don't remember which year this question was asked, but this was asked, burning feet syndrome. Then B6, called as a pyridine, cofactor for the pyridoxal phosphate PLP. Then the functioning is nutrient metabolism, H6 synthesis, neurotransmitter synthesis, and the interleukin 2 production. Deficiency will be causing peripheral neuropathic tingling sensations and sideroblastic anemia, and this one is the marker, this one is the PYQ. ठीक है, तो see peripheral neuropathy मतलब कि in the clinical case they will be describing that a patient comes with the complaints of tingling sensation in the lower limb or in the upper limb, and which vitamin deficiency causes this करके पूछ जा सकता है, because this is also an important one, B6, and the questions are usually asked on this peripheral neuropathy only. And this vitamin B6 is also required for 3 important pathways, that is the decarboxylation, protein metabolism, and the glycogen phosphorylase. Okay, so this is all about the vitamin B6 which you must know. Then B7, see, B7 is also a very important one. Questions are asked on this one in the past years. It is a cofactor for the biotin, and biotin helps in growth of the hair and maintenance of the hair. So whenever there is deficiency in the vitamin B7, it will be directly affecting the hair, तो hair fall cause हो सकता है, called as the alopecia. And in the question, if they are giving something like consumption of the raw eggs, gym trainer or a guy who goes to the gym, he consumes raw egg and now complains of alopecia, what might be the cause? So vitamin B7 deficiency or the biotin which will be causing this symptom, biotin deficiency. ठीक है, तो see this consumption of this raw eggs, no sorry, this biotin, whenever this biotin deficiency, it will indirectly cause this multiple carboxylase deficiency also. ठीक है, so this is also an important thing to remember, and it is required for the carboxylation. See, vitamin 7 B7 is required for the carboxylation. अगर इसी की deficiency हो जाएगी तो carboxylate, multiple carboxylase की deficiency होगी ना. So these are the clinical features associated with this one, and whenever you see this hair, then biotin, then gym, raw egg, straight away go with the answer as the biotin deficiency. Okay. Then moving on to the B7. B7 is also called as the folic acid. So remember the name. It is acts as a cofactor for the THF, tetrahydrofolate. See, like how folic acid converts to tetrahydrofolate, and it helps in the synthesis of the DNA and the RNA. So this is indirectly helping in the formation of the genetic material, and whenever this defect, it will be causing megaloblastic anemia, important one, and neural tube defects, a must know topic. See, neural tube defects, no, frequently questions are asked on this, the neural tube defects, like the anterior neuropore will not be closing, causing cranioschisis, anencephaly, sorry, anterior neuropore causer का anencephaly and posterior का क्या बोलते हैं स्पाइना बाइफिडा, एंड इफ बोथ आर नॉट देन क्रेनियोस्काइसिस करके आता है. ठीक है, सो दिस वी विल बी कवरिंग इन द एनाटॉमी, एंड दिस क्वेश्चन न्यूरल ट्यूब डिफेक्ट्स पे आई ट्राई टू मेक separate video only to discuss all the things, images and what all are needed for that. ठीक है, तो right now neural tube defects, and for this, to prevention of this neural tube defect in the pregnancy, we will be giving the folic acid supplementation 400 microgram per day, and in case of high risk pregnancies 4000 microgram per day. PSM point of view and OBG point of view also, this one is important question. And the markers for this vitamin B9 are the increase in the homocysteine. So homocysteine acts as a marker for this one, whereas the methyl malonate levels are normal. If both the levels are increased, methyl malonate and homocysteine, then it will be causing the vitamin B12 deficiency. So this is a point to differentiate this one, methyl malonate. This one is important one to differentiate between the B9 and the B12 levels. Okay, and test done for this one is the Figlu test after the histidine load, and the site of absorption of this folic acid is the jejunum PYQ. Okay, so these are the questions which you must remember from this folic acid. Then B12, the cyanocobalamin, acts as a cofactor for methyl malonyl CoA mutase, and deficiency causes megaloblastic anemia. See, the important features described of this megaloblastic anemia is that the RBC levels will be big, and the multiple segmented nuclei can be seen. ठीक है, तो मतलब the differentiation of the RBCs is not done properly. मतलब we know that hematology, the blood cell, RBCs मतलब various steps it undergoes, and it will be become small. मतलब पहले बहुत बड़ा size रहता है, it will undergo multiple steps, the steps of the maturation, and then it will be formed. तो मतलब पहले आरबीसी में न्यूक्लियाई रहता है, slowly the nuclei will get absented, but due to vitamin B12 deficiency, the maturance of this RBC is hindered, and it will be causing this anemia. ठीक है, तो megaloblastic anemia in the sense RBCs मतलब अच्छे से mature नहीं हुआ है. ठीक है, then deficiency will also cause demyelination of the neurons, causing peripheral neuropathy, and the symptom associated with this is the tingling sensation. ठीक है, तो tingling sensation we had seen two ways, एक B12 deficiency में दिखता है, एक B6 में दिखता है. तो if at all these anemia के features दिए गए हैं question में, then go with the B12 as the answer. If not, then go with the B2 as the B6 as the option. ठीक है, तो markers are this homocysteine and the methyl malonyl coenzyme A. Okay, so this was all about the vitamins, and in a single video only we have covered all the things you must know from the vitamin. I hope this video will be useful, and for the PDF, join the Telegram channel, the name Grow Med Fmge1, and the link will be given in the description box as well. Follow on the Instagram for more flashcards and all. And yes, thank you so much for watching this video. Stay tuned for more videos of such type, where we'll be discussing all the important topics one by one. Thank you so much for watching this video, guys. All the best for the exam.